Hello, my name is Dr. Pavan Murdeshwar. I am from Bangalore and I am a plastic surgeon. I've done my MBBS, MS and MCH from Bangalore and I practice at Helios Wound and Plastic Surgery Clinic, Jayanagar 9th Block, Bangalore. Podiatrist is a person who is specialized in treatment of the pathologies related to the foot and ankle. A diabetic foot is a condition where major abnormality is in the mechanical status of the foot. So it's always better to consider a podiatrist when a diabetic foot is diagnosed. So a podiatrist is required in such a condition for 4 different necessities. One is the preventative method, where it is essential for a podiatrist to diagnose the diabetic foot, to know what is the neuropathy associated with that, to guide you through the orthosis and the different types of the shoes which the patient can wear. A podiatrist is also required to refer you to a higher center where a vascular intervention might be needed. Second thing is the conservative ulcer care. When an ulcer is formed in the diabetic foot, it's always better to show to a podiatrist who is going to treat it on the basis of the triad of treatment, which consists of the local debridement, the dressing care, as well as the offloading strategies. The third one is the surgical interventions for the ulcer. So the surgical interventions can be a local ulcer primary closure, or it can be the different orthotic management where the bones which are protruding are to be removed, or it can be in the way of different tendon alignment, realignments, which will help in tackling the problem. And lastly, a podiatrist is also required in case of to prevent the recurrence of such kind of ulcers. So the preventing can be done by the various offloading strategies once again, as well as if the patient has got necessary amputations, then the rehabilitation is also guided by a podiatrist. So it's always better to remember that a podiatrist helps in decreasing the major amputation rates of a diabetic foot by almost more than 50%.